Crime is not a disease like COVID-19. An editorial by Professor Wallstreet, Minister of National Security Failgerald Hinds, recently compared crime to a disease like COVID-19, suggesting that it should be treated similarly, with everyone playing their part to combat it. While the intention behind this analogy might be to emphasize collective responsibility, it is fundamentally flawed and misleading. Here are 10 reasons why this comparison is inappropriate and why Minister Hinds is absolutely wrong. 1. Nature of the problem: COVID-19 is a viral infection caused by a specific pathogen, whereas crime is a social and legal issue rooted in human behavior and societal conditions. Treating crime as a disease oversimplifies its complex causes. 2. Prevention and treatment. Diseases like COVID-19 can be prevented through vaccines and treated with medical interventions. Crime prevention and treatment require multifaceted approaches, including social reforms, education, economic opportunities, and effective law enforcement. 3. Individual versus societal responsibility. While individuals can take personal measures to prevent the spread of a virus, crime prevention requires systemic changes and government intervention. It is not solely the responsibility of individuals to prevent crime. 4. Stigmatization. Comparing crime to a disease can stigmatize individuals involved in criminal activities, viewing them as infected rather than addressing the underlying social and economic factors that contribute to criminal behavior. 5. Resource allocation. Public health crises like COVID-19 demand immediate and substantial medical resources. Crime, on the other hand, requires long-term investment in social services, community programs, and policing reforms. 6. Public perception. Equating crime with a disease can lead to public misunderstanding and fear, potentially resulting in support for overly punitive measures rather than balanced, rehabilitative approaches. 7. Complexity of solutions. The solutions to crime are far more complex than those for a disease. They involve addressing poverty, education, family dynamics, and community support systems, which cannot be cured in the same way a disease can. 8. Role of government. The government's role in combating a pandemic is primarily through public health measures. In contrast, addressing crime involves a broader range of policies, including criminal justice reform, social welfare, and economic development. 9. Impact on policy. Viewing crime as a disease might lead to policies that focus on containment and punishment rather than prevention and rehabilitation. This could exacerbate the problem rather than solve it. 10. Moral and ethical implications. Crime involves moral and ethical dimensions that diseases do not. Criminal acts are choices made by individuals, often influenced by their environment and circumstances, whereas diseases are not a matter of choice. In conclusion, while Minister Hinds' analogy might aim to highlight the seriousness of crime and the need for collective action, it fails to capture the true nature of the issue. Crime is a multifaceted social problem that requires comprehensive and nuanced solutions, not simplistic comparisons to a public health crisis. By understanding the distinct differences between crime and diseases like COVID-19, we can better address the root causes of criminal behavior and implement effective strategies to reduce crime in our society.